Hello, everyone. My name is Esther Nana, and I'll be hosting today's event, Medication Compliance Packaging Essentials. So today's webinar will be approximately 20 minutes long, and all participants' lines will remain mute during the event. I'm sure you'll have questions and would really like to encourage you to ask. So by typing your questions in the chat box on your webinar control panel as depicted on the screen. If you have any technical difficulties, don't worry. You can always email me directly, esthern@EOC Events Network. EOC partners with DosePlanner to advance knowledge around healthcare and pharmacy space. Please remember to submit your questions at any time, but we will not be addressing them immediately, but we'll attend to them after the webinar. And if we can attend to all of them, we'll be sure to send some answers to you via email. So next, I'll give you a brief overview of our agenda today. Today, our speakers will spend some time providing a quick overview of the medication packaging market, and then dive into the specific types of packaging and how they're used. So now let me give you a little background on our presenters today. Marinka and Rick are both from DosePlanner. Richard is the CEO and founder of DosePlanner, and Marinka Natalie is the Director of Operations and Innovation at DosePlanner. So Marinka, you have the floor.
Great. Thank you, Esther. And if you would like to know anything more about us and our backgrounds and kind of our mission, we'd be happy to share that with you at a later time. I think at this point, though, we really have a small amount of time, a half an hour, and we want to spend most of that kind of sharing the information around medication packaging. So what is compliance packaging? Compliance packaging is also known as medication compliance packaging or adherence packaging. And what it does is it combines multiple medications in one packaging set. So how is that typically done? It's done through blisters, pouches, or boxes, either in an automated fashion through machines, or it can be done also manually. And so why do we do this? Because it helps to increase the adherence of drugs and the adherence of patients to their drug regimens. What's the process? Well, the process is that you get the information from the pharmacy management system, and that information is compiled and all of the drugs are put together and then organized by dose, days, times prescribed, and also the type of packaging that you would like to fill. So for instance, a weekly, monthly, whatever suits the needs of your patients. So the value, though, is it really makes it easier for the patient. It might be a little bit more time for you as the pharmacist, but it does take the onus off of the patient around remembering and having to do all of the distribution and parsing out of the meds at home, either by the patient's caregiver, or even the nurses and clinical staff at a home or a group home or nursing home. So I'm not going to spend too much more time on this. I think we know the benefits of medication packaging. It increases safety. It allows you to synchronize the medications all together so that both the patient and the clinicians, as well as the pharmacist, who is also a member of the clinical staff, doesn't have to remember to fill drugs throughout the month multiple times, but rather everything is synchronized on one day, and that is then repeated through the months. It also lowers expenses tied to penalties associated with DIR fees indirectly because of an increase in medication compliance and adherence, decrease in patients actually going to the pharmacist to pick up their fills. And then there is advantages associated with inventory and waste, especially if there is a patient who has who changes medications often, so you have less waste. Obviously, the fourth and probably the most important is the improvement in medication adherence of the patients. So that's always great. So that being said, Rick Munger is the owner of DosePlanner, and he's going to take us through all the different medication packaging options that we see today in the market.
Good morning, everybody. It's morning here in the Eastern time zone. So I'm here to talk to you about different types of medication packaging. And some of you may be familiar with med boxes. Either you use them yourself or you have them for other people that you care for. These have a long history and have been around for a long time. They have some specific advantages. They come in multiple colors. If you're on the go, you can take these separately out of the tray and take them with you for the day. They have a few problems when they're used at a pharmacy setting in order to comply with medication packaging. One of those is as time goes on, I'll show you here. As time goes on, the labels wear off. So on this one here, we had to go and put stickers on there to get them to be more compliant. So that way the patient would know what's going on. Also, there's not a lot of space on the tray for labeling what's inside each of these blisters. Thirdly, as you start using them and open them up, the hinge on here will break off. Not all the time, but it's prone to do that just from normal wear and tear. As they come back to the pharmacy and the pharmacy goes to reuse them, before they do, they have to go and sterilize each one of these in order to keep them clean so that you don't get cross-contamination with other drugs. So that's one type is these, and these have other various brand names, like Opus was a brand name that some people might recognize. They come in various sizes, super large, and this type might also contain things like small bottles of eye drops or other things that the patient may need. Unfortunately, I've never found any of these available in a tray, but you can get them super large if you like. So that's one type. Another type, but I don't have an example of it, is strip packs. Strip pack is something that basically it's also called pouch packaging. And it's where the multiple medications, or single or multiple medications, can be wrapped into a cellophane package, and then the cellophane package is labeled on the outside as to what the contents are. One of the more famous current brands is called PillPack. That's from Amazon. They bought the entire company because they liked the way it was being done. That style is fantastic for people that are on the go. Typically, younger people like it because it can be used for vitamins, it can be used for medications, and it's easy enough to go and pull a few strips of your packages out of the box, tear them off, and then bring them with you when you're traveling or you're on the go, and that's easy enough. The deficiencies with that method is it's very difficult to find out, did the patient actually take the medications? Because once you remove the pouches from the package, there's no tracking as to what's going on. If you go back to look at the box of meds, all you can tell is that if the box had 20 pouches in it, you can tell that 7 of them are missing, but you don't know exactly what happened to them. So the third method of dispensing is called blister cards, and blister cards come with single med, which has been around for a while. Nursing homes and skilled nursing facilities, hospitals love these because they stand up nice and straight in the med cart. There's a single medication in each of these, and typically they're a punch through style. Somebody would press on the blister and the medication comes out through the back side, and it's typically a foil coating so that the air stays out of it and keeps the medication as fresh as possible. advance fast forward a couple of years, and people started to make blisters a little bit bigger. So one of the innovations, this one comes from a company called Drug Package, the blisters got very large, and we're able to, with the same method, push the medication through the foil seal in the back, and voila, we have the medication. For people that don't have a lot of finger strength, there's something called a pill bob. This pill bob makes it very convenient for people that don't have that don't have finger strength. What they do is take the pill bob and they puncture the aluminum seal at the back, twist, and the pill will fall right into the cup, and it becomes the pill cup for the patient. So very convenient, a great idea. This is something that can be used by pharmacists either as a giveaway, they can use it as a for sale item, or some type of incentive to get onto their adherence program. So that's one method. Then there's another style of blister card called unit dose. Unit dose. Now this one is a jumbo unit dose, because each of these blisters are roughly almost 2 inches wide, and they're 1 inch deep, allowing the pharmacy to prepackage between 10 and 12 medications in one blister. So if you have a patient that has a lot of medications, a great choice. The other nice thing about this type of packaging is the unit dose, the plastic and the label are perforated. So this entire row can be broken off, and each row stands for one day of the week. So here's Monday, and you have Monday morning, noon, evening, bedtime, etc. So all of your doses are right there, and it's a very simple way to do things, very organized. Similar to your medication vials, all of the information, the same as what's contained on the vial, are all at the top, and it gives the, if these are going to be used at a nursing home, it's very easy for the nursing home to identify what's the medication, what does it look like. That way, if they get questioned about it, or if the doctor wants to see what's being delivered to the patient, they have a good idea of what's going on. One of the other nice inventions or modifications to this type of packaging is that it has these hooks on the side, these little ears. What those are for is to hang in the nurse's med cart. So those make it very convenient for the nursing staff. A small little innovation that we at DosePlanner have added is this little balancing piece that folds and allows us so that the nursing staff can see when you have a tight filled cart that all of the information about the patient and the card are right here on top, and it keeps the card from twisting and turning in the cart. Packaging for these cards can be problematic, but with a few easy packaging supplies, this is a panel that can be used either for a cold seal or a heat seal type of card. And I should probably tell you about the heat seal and cold seal before I get into the packaging. So there's two types of methods. One is a cold seal. That's where the label on this has a glued background, and it's actually sealed and pressed onto the plastic with a permanent glue. And it's very difficult once it's applied, it's very difficult for it to come off. The other option is to use a heat seal. A heat seal is better if, as you can see, this has a white paper background. Heat seal is great if you have a foil background, and foil background increases the permeability. So it rather decreases permeability so that air cannot get into the medications and contaminate it. So, but the problem you have with heat seal is as you're melting the plastic onto the label, the fumes from the plastic will actually minute parts of it will actually get into the each of the blisters. So there's pros and cons. Great because heat seal is also permanent. Um, Cold seal is much easier. You don't have to buy any equipment for it. It's just peel and stick. So, okay, getting back to the trays. These trays are wood and they have a cork top. They can be used for heat seal or for cold seal. And it's easy enough. You put the plastic blister into it. Your staff would then fill the card with the medications, peel the label and apply it right to this, and then seal it with a small pressure roller that it seals it and makes a permanent seal. Very simple process, roughly 4 to 5 minutes for 6 medications in a card. A little bit longer, but that equates to about 45 to 50 seconds per medication. So where was I here? These medication cards come in a variety of sizes. You can get them in, depending on which brand you do, you can get them in a 7 count, a 14 count, 28, 30, 31, 32, 60, 90. The list goes, you can go crazy. Typical applications that I've seen is the 7 and 14 day cards are great if, say, in an outpatient situation. We have facilities that are oncology facilities where they like the 7 and 14 day options because they want to see the patients within a week or within 2 weeks to come back for their more chemo drugs and things like that. The larger ones, 30, 31, 32, obviously monthly. The 28 count is probably one of the most popular. This one here being a 28 count card. You have 7 rows, 1 for each day of the week, and you've got 4 dose periods per day. There are other cards that are available with 35 row, and what they have is 5 dose periods and 7 days. So just a different option to it. So those are the different types of the most popular methods of packaging. All of these have manual and automated fill options. Just as you may see in a pharmacy that you either have or that you go to, some of the pharmacies have machines that'll fill vials, and there are machines that'll fill blister cards. There are, if you're going to use strip packs, you have to use a machine. There are no manual options for that one. By using a machine, the cost of the machines might start to look cost prohibitive at the beginning, $100,000 or more for a machine. But if you look at the time it takes for manual fills, you're going to recoup your costs in a very short amount of time by using automation. So let's see, what else can I tell you today? Let's see. I can give you a total cost here. Let's see. Dispensing time. We did some timings on a manual fill versus automated fill of a blister card using 5 drugs. And we found out that at $18 an hour with 5 drugs, it takes approximately 4.5 minutes to do that fill. That same fill can be done by a machine in 1 minute and 6 seconds, saving you roughly 3 minutes and 19 seconds, or giving you a savings of almost $60 over a period of a week. So at those rates, automation can save you a lot of money in a short amount of time. So.
Thank you so much, Rick. So if anyone has a question, you can go ahead a few minutes so we can take like 1 or 2 questions. You can put it in the chat box, or you can mute yourself.
There's one question here. What are the benefits of the notebook style blister?
So this one is one brand, and it's a notebook style. The advantages of it, I've seen them applied in a at-home setting, typically because everything's organized. It's easily labeled. It comes with a nice label with all the pictures of the drugs, and people can find out very simply what's in the card. The advantage of it is mainly that organization feature, but we also find this used in skilled nursing. And what they do is when they store it before they use it, they have the name of the patient on the side. They can store this on a standard shelf, and it's just like a book. So they can have a whole number of them, and they're very easily organized. And that's the main reason. There are other brands, like I said, here's the same thing from Drug Package. So again, the name of the patient on the side, and it makes it nice and easy.
So there's an observation by Joel from the audience. In the chat box, it says the code seal on the multi-pack seems to come apart on the notebook style. Card seems to bend when getting to the middle or inside. The pills mix in other blisters. Do you have something to say about that, Rick?
Yeah, Joel. We have had customers come back to us early on and say that type of thing was happening. We found in a majority of the cases that it was actually when you're doing the sealing, that's a part of the problem. So it's very important to use a tray, whether it's that one with a paddle or this one is just pure cork. It's very important to use that. And we've had I personally experienced this. One pharmacist gave me a call saying, everything's falling apart. I don't understand it. Can you help us out? Well, come to find out, we actually had to send somebody to the pharmacy. And when we did, we found out that when they were not using the trays and they were not using the rollers, they were putting it together. And then when they went to seal it, they were just doing this. And your hand on here is not enough pressure to seal it tightly. The other cause would be, and from time to time, the manufacturers might get a supplier that changes the glue, and the glue is not as good as it should be. If you have those type of problems, you're welcome to let us know. We can basically hook you up with a very good supplier that always has good quality products and can help you out.
Do you guys sell the automation?
Yeah. So DosePlanner started as a pure software company. As we got more and more involved, we got partners that were, and one of them's on the call with us here today. But we have partners that manufacture the labels and blisters. We have partners that manufacture the machines. And so, yes, we are authorized sales reps for the supplies as well as the machines. The idea for us was to become a one-stop shop. So if you purchased our software, you're welcome to come back to us. We can help you with the supplies. We can help you with the automation. And if we can't, we can certainly hook you up with the right people, so that way you can get the answers you need.
Great, thank you, Joel. He says thank you. So Marika, I think you can take the question you have.
Yes. So for the med boxes, are there labels associated with med boxes?
There are. So let me show you something here. One of the big problems with the med boxes is there's no room on the front for doing labels. Nicely and conveniently, though, the manufacturer of the med box gives this space here, which is roughly 6 inches long and 4 to 5 inches is tall. And our DosePlanner software makes a label that fits right into this. We started, and DosePlanner was invented at a pharmacy. One of my friends was a pharmacist and asked me to come in and help him because he started his business doing med boxes up until the time somebody started dropping them on the floor and the pills went everywhere. So, and then the dog comes by and tries to eat the pills. That gets everybody a little upset. But yes, we created a label here. It has all the same information as you would see on this label, except it's in a shorter 4-inch tall format, but it has all this same information on it. So the one problem with that label is you only have room enough for 7 to 8 drugs on the label. So thereby limiting your med box from the pharmacy to about 7 to 8 drugs per blister. So does that answer your question, hopefully?
Thanks. One more question is, can I reach out to you for more information about specific situations or needs associated with my pharmacy?
You definitely can. We're available from 8 in the morning Eastern. And because we have customers all across the country, we have some in Alaska and they're 4 hours behind us. So I've answered calls from people as late as 10 p.m. Eastern. So that's 6 p.m. Alaska time. So yes, you're welcome to give us a call. And if it's not myself, we'll have somebody able to answer your call. And it could be just about anything. I mean, we help people. They call us because frankly, they want to go print their labels and all of a sudden they bought a new printer and the printer won't connect. So yes, if you have our software, yes, will we help you with the printer? Certainly. So we'll help your IT team. If you have an IT team, we will guide them through what needs to be done. If you don't have an IT team, you're welcome to give us a call and we'll see what we can do for you.
Great. Thanks, Rick. Now, I know that we have a whole bunch of other questions and topics that we wanted to talk about that we haven't focused in today because they're a topic of their own, including monetizing and the ROI associated with medication packaging. And so we go ahead and share. So that's what we will have sessions in the near future to cover. Most of these questions here around monetizing your packaging program, increasing adherence, tracking and the effectiveness, and being able to make sure that you stay on track and ahead of DIR fees, state by state regulations and requirements associated with packaging, as well as how to go from manual to automated solutions, step by step as your pharmacy grows as well. So there's a lot more that we can talk about, and Rick is open to talking about it, right, Rick?
Absolutely. But the format here was just a limited amount of time. I could go on for 2 or 3 more hours if you like, but I figured everybody has to get to work. So
yeah. We know that you have lots to do today, so feel free to reach out to us individually or look out for our next sessions. And we hope to answer any questions and be a guide or reference to you as you try to meet the needs of your patients as well as grow your business. So, any other questions? Last chance.
All right. Questions. So thank you very much, Rick. Thank you, Marinka. That was a great presentation, and I hope it was informative to everyone. So, well, unfortunately, we would have to wrap up now. But just in case you missed anything, this was recorded, and you could always request to have a playback. And of course, if you'd like to take a deeper dive into the benefits of DosePlanner's application and services and how to make your multiple medication packaging process simpler, please reach out to any of us to schedule a complimentary one-on-one session. So thank you, everyone, and I hope you have a great day ahead and at work.